Eunice is from Draxer Therapeutics. She's a pharmacist at Draxer Therapeutics. Good morning, Dr.
Good morning,
Eunice.
Natalia.
How are you?
I'm fine. How are you too?
You are glowing today. What is it that you did?
Really?
You pharmacist, you know all the things to do to make yourselves look spick and span all the time.
Is that so? Maybe today's
It's
a
not.
good day. Today's a good day.
It's not so. It is so.
It is.
It is.
It is.
You know what to take, when, how, whatever.
You
so
know, yeah.
you're always covered, and you leave us in the dark.
No, not really.
Not really.
Not really.
All right. So this morning we're talking about food allergies. Something that I want to believe that everybody at one point or another has experienced a certain food allergy. So before anything else, can we go to the definition of what food allergies are? When somebody says food allergies, what exactly do they mean?
So, a food allergy is that exaggerated response that you get when your body mistakenly perceives a food item as harmful. You know, naturally, your body has an immune system that is supposed to identify dangerous stuff like viruses, bacteria, and eliminate them. But sometimes something strange happens and your body confuses food that is supposed to be harmless, certain food items that are supposed to be harmless. The body thinks that it's a virus or a protein, so it mounts an exaggerated attack towards these food items. So
Right.
that response that you get is what we call a food allergy.
Food allergies. Okay. And I know that it happens with a lot of people, but are there specific foods that usually give people these reactions?
Theoretically, every food item can cause an allergy.
Okay.
However, there are, let me say, like 8 of them that are very common. That cause about 90% of the allergies. There's milk, eggs, tree nuts. Tree nuts like almonds, cashew, pistachios. So milk, eggs, tree nuts, and then peanuts, which you call granules. And then seafood, shellfish, soy, and wheat. So these are the top 8 that cause about 90% of the allergies.
Okay.
But all food items can actually cause allergies.
Very interesting. And how will a person know that they are allergic to a certain food?
Okay, so usually allergies manifest when you are younger. In certain situations, people develop these allergies when they grow old. But typically, you would identify these allergies when you are young. And it happens when you eat some of these foods and you have the signs and symptoms associated with allergies. So, for example, you may get skin eruptions. You may get these very itchy eruptions on your body, which we call hives. They sort of look like when kakape bites you. You can also get these respiratory manifestations. You have difficulty breathing sometimes. You can have runny nose, runny eyes, and sometimes some of these allergies can progress into some more serious forms, which can become deadly or fatal. Yeah.
Very interesting. And would you also say that sometimes after a while, it goes away, like with that particular food? The reason why I'm asking is that I used to react to a certain particular drink. And any time that I drank it, I got the hives. But I like that drink, so I didn't stop. But then I realized that over time, then I don't get it anymore. And I still drink it.
It can happen. Actually, some children outgrow their allergies.
Okay.
And usually when it is with milk, for example, they can outgrow it. But it has been observed that peanut allergy in particular, it's rare to outgrow it. So there are some people who may be allergic to certain foods. Maybe they eat from time to time. I don't know, maybe their body decides that this girl is not hearing, so let's spare her.
Let's leave her to
Let's
be.
leave her, yeah. So it
Okay.
can actually happen. But
Okay.
for peanut allergy in particular, it's rare.
It's rare.
It's rare.
Very, very interesting. And then what would you also say about lactose intolerance?
Yes, it's good you've brought that up. lactose intolerance is actually a food intolerance. And food intolerance is different from food allergies.
Right.
So food intolerance are typically associated with your digestive system. So if you are intolerant to a particular food, when you eat it, you get diarrhea, you get bloated, like you feel pain in your abdomen, typically for food intolerance. And additionally, for food intolerance, the amount of food you eat, which causes that intolerance, is directly proportional to the reaction that you get. So, for instance, if you are lactose intolerant, which means that you cannot digest the lactose in milk, for which reason you get the diarrhea and the cramps. When you eat, say, a cup of milk, which contains lactose, the reaction you get is proportional. However, if you ate maybe a bucket of milk, I don't know how you're going to consume that, then the reaction that you get will be that large. However, for an allergy, you can eat just a teaspoon of the particular food item you're allergic to and get a full-blown reaction. So that's the difference between the two.
That's the difference between the two. That's very interesting. And also for people who are lactose intolerant, they have cheat days. They have days that they tell themselves that today, as I'm not going anywhere, I'll eat ice cream. I don't care.
Yeah.
Damn the consequences. I will eat ice cream today.
Yes.
But is there a way to deal with allergies? Like, are there things that for people who would say something like, I like it this much, and I want to eat it, but if I ate it, is there something I can do or eat in addition that would prevent the reaction from happening?
As a pharmacist, my recommendation is, if you have an allergy, as much as possible, avoid the food item, because these allergies can get worse with time. However, there are certain medications that can help you to deal with the signs and the symptoms of some of these allergies. So, for example, when you go to the pharmacy and you report that you have allergies, there are certain over-the-counter medicines that they can give you that can help you to deal with the signs and symptoms.
Right.
Like the itch, for example, they can give you an ointment that you can use. They can even give you antihistamines, yes, which can also help you to deal with the signs and symptoms. But the surest way to deal with the allergies is to avoid. And I know how frustrating that can get, because for many of these people who have allergies, the foods they are allergic to happen to be some of their favorites.
I know.
So recommending they avoid these foods is not easy at all.
No,
I
it's
can
not.
actually understand.
No, it's not. So what you're saying is that really nothing can be done about allergies. You just need to stay away.
Yes, the current, how do I put this? Where we have reached in medicine and scientific discovery, there's no medicine you can take that can eliminate your allergy. For instance, if you are allergic to peanuts, there's no medicine currently that you can take that can make you not allergic to peanuts anymore. No.
Right.
What we have currently are medicines that can help you to deal with the symptoms, for instance, like the runny nose you get, or the skin eruptions, or the hives that you get. But for eliminating the allergy totally, we haven't reached there yet.
Right. So in short, allergies cannot be treated.
Unfortunately.
Unfortunately not. And the signs are pretty basic. It's either you're itching. I know of your face swelling up.
Yes, your face can swell up, yes. You can get reddening of your face as well. Your throat can close up sometimes and make it difficult for you to breathe. Yes, and associated symptoms.
That's very interesting. That's very interesting. We like this knowledge. Every time we hear it, we completely understand and know what we have to do. Yeah. So, Dr. Eunice, tell us something. You are from Draxer Therapeutics.
Yes, I am.
Where are you located?
We are located at Bashona Spintex. When you get to the EcoBank at Spintex, yes, and you take a right where the traffic light is, you can drive for like 2 minutes, and Draxer Therapeutics is on your right.
All right, great. So what were your final words? How will you wrap this up for us?
Okay, so my first recommendation will be that no matter how much you like some of these foods, if you have an allergy, it is recommended that you avoid these things. Because apart from the fact that allergic reactions can be uncomfortable, they can also, although rarely, lead to severe consequences. And sometimes they can even be fatal. I mean, imagine getting an allergic reaction, your throat closes up, and you're having difficulty breathing. It can get serious, and it can get very uncomfortable for the people around you.
Right.
So when you have an allergy, my recommendation will be to avoid it. However, in the event that you are exposed to some of these medicines that you're allergic to, the best thing will be to seek medical help immediately so that the signs and symptoms can be managed for you.
Thank you, Dr. Eunice. We really appreciate this. And I know I'm due to come by Draxer.
Yeah, I would love to see you.
I would absolutely pass by.
Okay.
Yes. Thank you so much. All right, so there you have it. Doctor's notes this morning talking about food allergies and how you can stay safe. My name is Natalia. This is